You are an FI1 working on a general surgery ward, and one of your patients has a chest drain in situ. On the ward round, your team are happy for the chest drain to be removed. There are no nurses able to remove the chest drain on your ward, and you and your FI1 colleague haven't seen or done one. Your FI1 colleague is very confident and says that they will remove the chest drain. They want to learn through experience and doubt that it can be very difficult. Rank in order the following actions in response to this situation. 1 equals most appropriate, 5 equals least appropriate. A. Agree to assist them so that you can learn as well. B. Ask the nurses to keep your FI1 colleague away from the patient because they are dangerous. C. Ask your FI1 colleague not to tell you any more about their plans to remove the drain as you don't want to be implicated if something goes wrong. D. Ask your registrar to come back from theatre between cases to supervise your colleague. E. Discuss with a respiratory doctor the details of chest drain removal and whether they would recommend you removing it unsupervised. Answer: D, E, B, C, A. It is absolutely imperative that you and your colleagues practice medicine within the boundaries of your competence to protect patient safety and to protect yourself from legal challenges if something goes wrong. The best response here is option D. If your registrar could come back to supervise you, you would be able to learn how to remove a chest drain and ensure that a competent doctor is present at the time to deal with any complications. Option E is the next best response as, when struggling to work with a specialist piece of equipment such as a chest drain, it is a good idea to get advice from the people who use it the most, in this case the respiratory or cardiothoracic team. They would also be able to tell you if they thought that removing it unsupervised was an appropriate thing to do. Option B is the third best response because although you would be showing a poor working relationship with your colleague by asking the nursing staff to guard the patient for you, the patient is at least protected against an underqualified doctor who could cause serious harm. Options C and are rank last because they involve your FI1 colleague going ahead with the chest drain removal. Option C is marginally less bad than A because you are not implicating yourself and supporting your colleague by removing it with them. However, you would still be doing nothing to stop them. Once a week you are required to attend FI1 teaching. You are managing to find the time to go every week, but you are disappointed by the quality of the teaching. You have discussed this with your colleagues. They agree that the topics are repetitive, and the speakers seem ill-prepared. You do not feel that you are learning as much as you should from the sessions. Choose the 3 most appropriate actions to take in this situation. A. Accept that the sessions are a waste of time and continue to attend. B. Discuss your concerns with your educational supervisor. C. Encourage your colleagues to discuss the quality of teaching with their educational supervisors. D. Fill in an anonymous feedback form detailing your concerns. E. Stop going to the sessions and ask to sit in on an outpatient clinic instead. F. Stop going to the sessions and use the time to do your own reading. G. Suggest to the teaching coordinator some topics that you and your colleagues would like to be included in the sessions. H. Volunteer to lead one of the sessions. Answer: BCG. The General Medical Council, GMC, states that you must keep your knowledge and skills up to date throughout your working life. Your education is your own responsibility. Therefore, in this scenario, you are obliged to act when the teaching you receive does not meet your expectations. Discussing your concerns with your educational supervisor, B, is a good response since their role is to support your learning. Option C is also an acceptable response since the issue is more likely to be resolved if a greater number of FI1S are raising a similar concern. If you feel that the current session topics are not useful, then a constructive approach would be to suggest topics that you and your colleagues do consider useful. G. Volunteering to lead a session, H, assumes that you will deliver a better standard of teaching and does not provide a long-term solution. While filling in an anonymous feedback form, D, may be appropriate, it is less likely to promote change than the previously discussed responses. You are expected to attend the scheduled FI1 teaching. Therefore, avoiding the sessions, even if you do make constructive use of the time, is inappropriate. Options E and F. Failing to address your concerns, A, is completely inappropriate and shows a poor attitude towards your work, your colleagues, and your professional identity.